You are likely to be admitted on the day of your operation. It is important to call the ward before you leave home to check that your bed is available. You will be advised when to stop eating and drinking. You will be welcomed to your ward.
Follow me, I'll take you to your bed space. How are you this morning? I'm fine.
Once you are settled, a nurse will carry out an assessment. This is a good opportunity for you to ask any questions that you may have. The nurse will measure your temperature, pulse, respiration rate and blood pressure.
It's important that you bring all your medication with you in the correctly labelled boxes so that the doctors know exactly what you're having.
We'll look after you during your stay, and if you need your medication during the time, we'll ensure that you get it at the right times.
We take the risk of deep vein thrombosis very seriously, and you will be risk assessed to help guard against this. It's important that you help us to help you by wearing your AV boots whenever you're not on your feet.
We use AV boots to reduce the risk of blood clots. Blood clots are a potential risk after hip or knee surgery. The way they work is that we have a bunch of veins on the sole of the foot that under normal circumstances, when you walk, squeeze blood back up the leg. After surgery, when you're a little immobile and you're in bed, there is a risk of having blood clots form because of that. So what the AV boots do is they pump the blood back up for you, and they've been shown to massively reduce the risk of blood clots.
Some patients may need extra medication, which is blood thinning medication, as well as the AV boots, but that will be decided upon your risk assessment.
Every single patient is assessed on an individual basis. Everyone will have lovely booties on their feet that pump the blood and keep the blood circulating, which will minimise the risk of blood clots. Everyone hates them. They're a cunning plan to make you get out of bed and walk. And the sooner you walk, the sooner the blood circulates, the lower the risk.
All right, we're going to measure you up to the frame, so if you stand yourself up.
A physiotherapist will come and visit you on the ward to give you walking aids adjusted for your height.
And then turning, if you turn this way, so move the frame.
And check that you know how to use them correctly. The anaesthetist will visit and examine you to make sure that you are fit for surgery.
Hello there, nice to see you again. I think you've had an operation with us before. Yes, right.
He or she will explain the anaesthetic process and go through the different types of anaesthetics that are available. There is a feature dedicated to these options on this website.
Good, all right, nice to see you again. Nice to see you. All right, cheerio.
Finally, one of the surgical team will meet you and mark the leg that will be operated on.
We've met before.
Yes.
How are you today?
I am fine, thank you.
Good, lovely. What are you having done?
I'm having a total knee replacement on my right leg.
Excellent. Is there anything you want to ask me?
I don't think so, thank you.
Okay, lovely. All we have to do is...
This will be another chance for you to ask any more questions you may have about the operation or recovery process. Everyone will be very happy to answer your questions. It's much better to ask than be worried about something.
Great, you're all done. I'll see you a bit later.
Thank you very much.
You're welcome.